before I enter the room, I'm going to look at the door to see if my patient is on fall precautions or isolation precautions. I'm going to knock on the door and perform hand hygiene. As I walk into the room, I'm going to assess the environment for any environmental hazards. I'm going to look at my patient. My patient is in a relaxed posture. Her facial expression is relaxed and her hygiene is appropriate. I'm going to introduce myself. Hello, my name is Isabella and I'm going to be your student nurse today. Can I please see your name band? Can you tell me your name?
Joanna Stevens.
And your date of birth?
5389.
Thank you. And are you in any pain today, Ms. Stevens?
No.
If my patient was in pain, I would assess on a 0 to 10 scale and I would use old carts. I'm also going to obtain my patient's vital signs, her blood pressure, her pulse ox, her pulse, her respiration rate, and her temperature. Patient has already stated her name. Can you please tell me where you are?
John Tyler Hospital.
And can you tell me what today is?
Tuesday.
Patient is alert and oriented times 3. Patient is making appropriate eye contact and her speech is clear, articulated, and appropriate. I'm going to check her pupillary responses. Can you look at my nose? Patient's eyes, pupils, are equal, round, and reactive to light and accommodation at a size of 4 millimeters. I'm going to have my patient close her eyes. Can you tell me where I'm touching?
Left arm. Right arm. Right leg. Left leg.
Okay. And there's no sign of ptosis or facial drooping. I'm going to hand my patient a small sip of water. I'm going to assess her swallowing ability. No difficulty swallowing noted. I'm going to move on to my respiratory system. I am going to observe my patient's breathing effort. She's breathing effortlessly, no evidence of accessory muscles being used at a rate of 16. I'm going to listen to her anteriorly, laterally, and posteriorly. Take a deep breath.
The girl that did it used to be a CNA, and then she started like just transporting, and then she got a job with them, and she's you don't mind being around dead people after it's a good gig, huh? Yeah, I just don't. Joe Tyler has services. I think that would be cool. I mean,
Can you sit up a little bit?
well, and that's, I think, especially having worked in palliative, like,
Yeah, I worked oncology hospice.
yeah, so I had and it's funny because
There's no
I had a nurse
evidence
the other
of
day
crackles or
call
wheezing
me,
or
and I
pleural
had to
rubbing.
go how to do postmortem.
There's no evidence of cyanosis in her nails or in her mucous membrane, no evidence of clubbing. Now my patient take a deep breath in and cough. That's a non-productive cough. It was productive. I would look at the mucus and assess the color and quantity. I'm going to move on to her heart sounds. Going to listen to the apex of her heart for a full minute, listening for S1 and S2 sounds. I'm going to also observe her rate and rhythm of her heart.
Well, I had a couple of nurses who
No S3 or S4 sounds heard. I'm going to compare her apical pulse to her radial pulse. And there's no pulse deficit noted. I'm going to listen to her heart sounds with the diaphragm, the aortic,
well, where is the
pulmonic,
what do you use
the tricuspid,
to plug the holes?
and the mitral.
Plug the holes.
I'm going to do it again with the bell.
They plug them.
like ears, nose, mouth.
Yeah. We were like, yeah, no, we don't do that.
I'm going to assess her capillary refill.
I was like, oh.
Okay. She has good capillary refill. It's less than 2 seconds. I'm going to palpate her radial pulse bilaterally.
That's funny.
Her amplitude is 2. I'm going to go down to her dorsalis pedis pulses. Amplitude of 2. And her posterior tibial pulses. Also amplitude of 2. Her lower extremity is warm.
All right.
And her upper extremities are warm. and there's no signs
You will
of
see me
pre-tibial edema. I'm going to move on to my to the muscular system. I'm going to have my patient push up with her arms and then push down. Okay, can you push up with your legs, please? Push back down. Okay, can you bend your left knee and then your right knee? You can relax your legs and lift both your arms above your head and cross your arms across your chest. Okay. Patient has a 5 out of 5 muscle strength on both her upper and lower extremities. She also has full range of motion, no limitations noted. My patient is symmetric with no deformities noted. Her skin is, overall color is appropriate to her race. Her skin is warm and dry. Her skin charger is elastic. Her skin is intact and there are no lesions noted. I'm going to assess her nutritional status. And I'm also going to assess the contour of her abdomen, which is flat. I'm going to listen to her bowel sounds in all 4 quadrants, starting in the right lower quadrant.
You obviously do not remember what it's like to be a student. And so,
There are active bowel sounds in all 4 quadrants. I'm also going to palpate for any tenderness or masses, any lumps. Do you feel any tenderness there?
Where you came from, and remember.
Are you having any difficulty passing gas?
No.
When's the last time you had a bowel movement? This morning.
I don't.
And are you tolerating your current diet well?
Yes.
Okay. How about any problems urinating?
No problem.
Okay. I would assess my patient's urine for color, clarity, and quantity. If my patient was on bed rest, I would turn her every 2 hours. Because she's not, I'm going to help her transfer her to the chair. I'm going to note any assistance that she needs, any her tolerance to activity. I'm also going to see if she needs any ambulatory aids. I'm going to assess the equipment now that we are going to be using on our patient. The oxygen is going to be attached appropriately to the wall into my patient at the rate that the doctor has ordered. The IV is going to be, I'm going to check for the right medication, the right rate that the doctor ordered, check the infiltration site, or I'm sorry, the IV site for infiltration. I'm going to check for draining, any drains, make sure there's no signs of infection at the site. Check dressing, make sure the dressing is dry and intact. I'm also going to see if she has a catheter. It's going to be attached to her leg with no kinks in the tubing, and the reservoir is on the edge of the bed. I'm also going to see if she has any SCDs, TEDs, or foot pumps. Before I leave my patient, I am going to make sure that the bed is in the lowest position.
Yeah, that's what I've been told. I just need to.
Call bells within reach. Side rails are up. Bed is locked. And bed alarm is armed, and I'm going to document my findings.